Role of AI in Pediatric Ophthalmology by Kirandeep Kaur Bharat Gurnani. The growing accessibility of ophthalmic data, combined with progress in artificial intelligence and machine learning, holds the promise to revolutionize clinical practice. Machine learning methods, when applied to general ophthalmology, have shown promising capabilities in areas such as automatic disease identification, preliminary screening of primary care patients for specialist consultations, and contributing to scientific research. Serving alongside ophthalmologists, these and upcoming applications hold the promise to enhance patient care, cut down expenses and access hurdles, minimize unwarranted referrals, allow for consistent monitoring, and facilitate early identification of diseases. Special considerations in pediatric eye care. The prevalence, causes, symptoms, diagnosis, and treatment of eye diseases vary significantly between adults and children. These differences are crucial to take into account when designing artificial intelligence applications. Children often experience conditions such as amblyopia, strabismus, blocked tear ducts, also known as NLDO, ROP, and inherited eye disorders. Glaucoma serves as a prime example since the origin and symptoms in congenital glaucoma patients differ significantly from those with adult-onset glaucoma. Retinopathy of prematurity. In the field of pediatric ophthalmology, the most notable AI advancements relate to ROP, a major cause of childhood blindness globally. Initial efforts to detect plus disease in fundus photos centered on the measurement of vessel tortuosity. One pioneering method sought to measure tortuosity through the spatial frequency of hand-drawn vessel traces. Since that time, multiple tools like Vessel Finder, Vessel Map, ROPTool, RISA, CAIAR, and IVAN have been introduced. However, newer techniques for identifying ROP and plus disease predominantly utilize convolutional neural networks, CNNs. Systems such as those by Wuerl et al., IROPDL, and Deep ROP employ this approach. These CNN-based methods analyze fundus photos directly, eliminating the need for manual annotations. Improvisation potential. While existing ROP detection techniques can differentiate between severe and mild ROP, they don't provide detailed insights into the disease's stage or zone. Only systems like Deep ROP and MeGraph consider more than the posterior pole view, with others either neglecting or purposefully omitting alternative views. Even though research indicates that severe conditions rarely occur without posterior pole vasculature changes, offering a more comprehensive breakdown of the disease's zone and stage might enhance the system's clarity and effectiveness. Insights into pediatric cataract. Cataracts in children are more varied than in adults, influencing the decision to surgically remove them based on their severity and the risk of vision impairment. The CC Cruiser is a cloud software that can identify cataracts from specialized eye images, classify them, and suggest possible treatments. It first adjusts the image to focus on the lens, and then utilizes 3 distinct convolutional neural networks, based on modified ALEXnets, to determine if a cataract is present, grade its characteristics, and advise on treatment. When tested in a comprehensive study across 5 eye care clinics, CC Cruiser's accuracy in detecting cataracts and suggesting treatments was 87.4% and 70.8%, respectively, which is lower than human experts who scored 99.1% and 96.7%. Insights into strabismus. Strabismus affects 1 in 50 children and can cause amblyopia, interfere with binocularity, and have lasting psychosocial effects. A CNN was used to detect strabismus based on visual manifestation in the eye regions of facial photos, which would be especially useful for telemedical evaluation. For in-office evaluation, which in contrast permits the use of specialized screening instruments, strabismus can be detected using a CNN based on fixation deviations from eye tracking data or with very high sensitivity and specificity from retinal birefringence scanning. Insights into vision screening. Strabismus and refractive error can both lead to amblyopia, and unfortunately, they're not easily detected by pediatricians. To address this, experts recommend instrument-based vision screenings. Most of these instruments can be adjusted for signaling when there's a potential issue. Van Eenwyk and colleagues utilized video frames from a device that merges Bruckner pupil red reflex imaging with eccentric photorefraction. They trained several machine learning models to identify risk factors for amblyopia in young kids. Of these, the C4.5 decision tree stood out as the most effective. Insights into myopia. High myopia can lead to severe vision problems. To prevent or slow down its progression, children who are susceptible to high myopia can be given low-dose atropine. However, deciding which children should receive this treatment can be challenging. A study by Lin et al. Used a random forest to forecast high myopia in children based on clinical data, providing reliable predictions for as long as 8 years ahead. Continued research in this area may assist in guiding preventive treatments. As AI becomes essential in pediatric eye care, it's crucial to address ethical concerns, data protection, and the clarity of algorithms. It's imperative for AI creators, ophthalmologists, pediatricians, and regulatory agencies to work together to guarantee the safe and conscientious implementation of AI solution. By refining early detection processes, boosting diagnostic precision, and tailoring treatment plans, AI is reshaping how we approach children's ophthalmology. As we journey through this promising era, harmonizing human skill with AI advancements is essential to ensure a more promising future for young individuals facing visual difficulties.